Hi everyone, this is Favor. I'm the founder and the instructor for Prompt Review Academy. I'm here to talk about briefly the 7 frequently asked questions to prepare, study, and successfully pass the MP board exam. So many people have asked me questions on this issue, and I said, okay, I will go ahead to make a video concerning this. So my video will be based on personal experiences and also some of the things I heard from other people mention, which I know that can also help you that is listening to me. So thank you so much for stopping by to listen to me, and I hope that as I go through these simple tips, is going to help you to prepare and successfully pass your MP board. Thank you. First of all, the first question is, when do I start to prepare? So many people ask this question, when is the right time? Is it when I'm still in school? Is it after graduation? But like I said, whatever I'm going to say is also based on personal experience and also what has helped other people to succeed. So the first thing to do, or the first thing to remember, is time, sacrifice, and commitment, which is your TSC. So for you to start preparing for your board exam, time is very important. You have to set that time because it's going to require time and also sacrifice and commitment. So some people, if it's convenient for you, you can start after completing your 3 Ps in your school. So what are the 3 Ps? Which is your advanced health assessment, advanced pharmacology, and advanced pathophysiology. So most of the time, once you have completed those 3 Ps, it's always advisable to start looking into sample board questions. Also, 1 to 2 months before graduation can also be helpful, or depending on a lot of people's suggestions, 1 to 2 months or 1 week after graduation. But like I said, this is personal experience and other people's opinions. But the honest truth that I understand that things happen in life. You might not be able to fit into these 3 categories, like after completing your 3 Ps, or 1 to 2 months before graduation, or 1 week after graduation. But the most important thing is, whenever you are ready to start preparing your board exam, time is very important. You need to know that you are going to create time for that. And also you need to sacrifice. It's going to cost you your money. It's going to cost you your time. It's going to cost you your pleasure. For example, if you are somebody that likes to, go to places, especially for fun, it might cost you that. It does not mean that you are going to stop having fun. But just remember, sacrifice, it can be your pleasures, things you like to do. Maybe you like to watch some TV shows and all that. But now you are bringing in something into your life that you have to, that is the priority. And also commitment, you have to be committed to that. So remember, time is very important. You have to create time for that. Sacrifice and also commitment. It doesn't matter if you don't fit into 3 of these categories, which is completing your 3 Ps, or 1 to 2 months before graduation, or 1 week after graduation. Some people also start 1 month after graduation because, like I said, it depends on life activities and whatever that is going on in the person's life. Every situation is not the same. Which exam do I take? This is another questions people ask. Is it ANCC? Is it AAMP? Both exams is very important, and like I said, I don't think any of them is more superior than another. So I believe it's just your personal choice. So when you talk about ANCC exam, it consists of 175 questions. and 150 items are scored, and the remaining 25 are pilot test items. So its total test time is 4 hours, which includes some of the tutorials, directions and all that, but the actual test is 3.5 hours. So like I said, everybody is different. I took both exams, and I can tell you ANCC focuses what? They focus on professional roles, healthcare policy, and you also need to know about their exam styles, like drag and drop, photograph, EKG strips, select all that apply. And the good thing is that they are going to tell you how many you should select. But to be honest, so many people don't really like the format because of select all that applies. If you are the person that falls in that category, then you have to consider AAMP. If you are not the type of person that likes policy questions, Medicare, Medicaid, or research questions, then that might not be a good fit for you. And if you're somebody that you don't think that you can stay like 3.5 hours to take exam, then you can consider AAMP. But like I said, it doesn't matter the exam that you take, even though some people say that it's very important that you need to know what is going on in your environment, because some people say that where they stay, some of the employers prefer ANCC, while other people, they don't really care. But for me, I think that both exams, it doesn't matter the one you take. What matters most is your passion. For ANCC, I will always say also, if you're interested in going into education, if you're interested in teaching, if you're interested in anything about policy and research, then ANCC will also be a good fit for you. And if you are somebody that like different styles of questions, like pictures, like select all that applies, like drag and drop, then ANCC will be a good fit for you. But AAMP consists of 150 questions, and it takes around 3 hours to complete, 15 of which are pilot questions. So 15 are not graded, and this AAMP is classic what? Multiple choice format with 4 answer options. So that is to tell you, they will provide 4 options for you to choose, and it's purely clinical questions. Why ANCC is both clinical and non-clinical. So you need to take note about that. So other people also take both exams, and people still ask, why do people take both? I think it's personal preference. Some people say that they register for both in case they fail the other one, they can pass the other one. While some other people love to be double certified. So whatever is the case, but always remember, both exams are very important. It doesn't matter the one that you take, except your employer specifically wants you to take a particular one. But outside that, it doesn't matter the one that you take. Also for ANCC, the passing score is 350 or higher. And also, if a candidate fails, the person can reapply online, but that person have to wait for 5 days after taking the exam to apply for retest. And ANCC allows up to 3 times in a 12-month calendar period for a retake, at least 60 days waiting period between each exam. Why AAMP, the passing score is 500, and there is no wait time, no requirement prior to retesting. But however, the person will need 15 contact hours in the area of weakness. So that is very important. Remember that 15 hours contact CEU. So that is the only difference. The passing score for ANCC is 350. The passing score for AAMP is 500. So where should I start from This is another question. Where? So the first thing I suggest is to shop around. What do I mean by shop around? Depending on when you plan to start, if you want to start 1 month before graduation, or after completion of your 3Ps, or 1 week after graduation, the first thing you need to do is to start looking into review courses. What are the review materials out there that can help me to prepare? You start asking questions. You can go to the internet and type in questions regarding this to be able to know the right resource courses, review courses, materials that you will need to prepare. Also, if you're on any Facebook group, that is also helpful. If you're not on one, it's very important that you join, because there's a lot of helpful social media platforms that have really helped people, especially Facebook, Instagram, WhatsApp group. So please, it's very important to shop around, know what is happening, know the review courses that can help you, know the review materials that can help you. At least you can take some time to be able to gather some of those materials before you actually start preparing. So that was basically what I did. I took like 1 week. I started looking into so many reviews. I read people's review comments about that review. I keep researching, trying to know the review materials that will help me, trying to know the review that I'm going to attend. By the time I gathered all those information, that was a helping point for me. So it's always good for you to shop around. Try to know what is going on. Try to find the resources, materials that can help you. Another thing to do is to develop a study plan. Study plan is very important. And when you develop a study plan, try to focus on your study plan, because study plan helps you to be more organized. Study plan helps you to be more focused. There's a lot of things to cover in this exam. It can be so overwhelming. You will ask yourself, like I said, I don't know, during my own time, I was like, where do I start from? This is a lot, Just trying to figure that in your head can also be a stress. Where do I start from? What do I do? But if you can develop a study plan, the study plan can be, each week I'm going to study a specific body system. Maybe you are going to do cardiovascular. Another week endocrine. But the most important thing is you need to know your areas of strength and areas of weakness. If cardiovascular is your areas of weakness, then you can devote more time to the study of that. But if endocrine is not a big deal, then you can just put in like few times. So it depends, but develop a study plan. That is very important. And try as much as possible to be focused. Try as much as possible to be organized. So I love this quote. It says, a dream written down with a date becomes a goal. When you write down in your study plan, I'm going to study for 6 weeks, I'm going to study for 1 month, I'm going to study for 2 weeks. So you have to write it down. When you write it down, it becomes a goal. A goal broken down into steps become a plan. And you have that plan. A plan backed up by action makes your dream come true. So the next point is for you to do what? To implement, to follow your study plan. How do I prepare? Consistency is the key to success. Don't forget that. Consistency. Always remember, when you are preparing for this exam, there are 2 things that is very important. The content versus the concept. What do I mean by content versus concept? Content is that you have to know your material. You have to know your stuff. Don't assume that you know it. Overconfidence is another big issue. Don't assume, oh, I know pharmacology, and because of it, you don't think it's important to study that. That will be a big issue. So you need to know your content. You need to have knowledge of all the body systems. Content is very important. And you also need to know your concept. How do you get the concept? When you do a lot of practice questions, then you begin to analyze, then you begin to understand the content very well. The big problem that people make is that they might know the content, but they don't really know the concept. Or if you know the concept, but if you don't know the content, is also a big issue. So please, it's very important that you know the content. Have a strong knowledge. Knowledge is power. Study with your review book or review courses. Then how do you know your concept? When you keep practicing a lot of questions. I cannot overemphasize on practice, lots of questions. It's very important. You can make your study plan to include daily practice questions. Even if it's 25 questions a day, even if it's 50 questions a day, but it's very important that you practice and practice and practice again, because that is the only way you can understand the concept. Also, study at least every day. I know that things do happen. I know we are so busy with life, but as far as it depends on you, study at least every day. Even if it's 20 minutes of your time, even if it's 1 hour of your time, but make sure you are able to study something at least. Even if you don't know any other thing to do because you are so busy, why not just check on your YouTube? You can just click a topic, look at that topic, just listen to that topic, even if it's just 5 minutes. That is part of the study. Nothing, every knowledge you acquire is not a waste. You can just check a topic on YouTube, listen to it, or you can just glance through your book. But make sure that no day passes without you looking into your book. You can look into your book, you can look into a video, but it has to be something that will help you to pass this exam. That is very important. Don't go, when you make it a habit, it becomes so easy. It's not a big thing. You can just click on your YouTube, you research a topic and listen, even if it's 5 minutes. But it's very advisable you study at least every day. Should I take a certification review course? What review do you recommend? This is an individual question, but most students feel more confident in doing so. There are several excellent points to note before purchasing a review courses. So it's very important, people ask, do I really need to purchase a review course? Do I really need to attend a review? But I tell you that if you can attend a review, that will be very, very helpful. Like I said, this is personal choice, but if you ask me how do I feel about it, I will say yes. But for you to purchase any review, you have to look at the quality of that review. Does this review covers the content and the concept, like I said initially? It's very important. Then you also need to look at your learning style. There are so many reviews out there. If your learning style is the one that is live review, join in a live review. If your learning style is the one that you like recorded videos, purchase a recording. If your learning style is the one that you like pictures, whatever, but first of all, you need to go with your learning style. I know there are several helpful reviews out there, but one thing I found out is that every review might not be for you. You just need to find a review and stick on that review. How do I prepare? I have found out that no matter what, it is difficult to feel 100% prepared. So helpful tip that will help you to know when you are ready. One of them is that you have to test yourself on the materials. If you have a study guide, go through the topics or questions. Like what I do is I glance through the book and I make sure, okay, I know this topic, I know this topic, I know this topic. So it's always good for you to test yourself on the material. Go through the topics or questions one by one. Answer the questions without you looking at your notes. Evaluate your confidence. In as much as it's difficult to feel 100% prepared, but deep down in your heart, if you are confident, at least you already covered most of the materials. That will be very helpful. You can also ask a friend to quiz you or try to explain the material. This is another thing that was so helpful to me. You can call your friend, explain the materials to your friend. If you can explain that material clearly to someone who doesn't know it, if they understand you, it shows that you are prepared. If you cannot explain it, you keep going back and forth on your book, on your resource materials, then that means you need to study more. Also, when you are in doubt, you can take a predictor test. There are so many predictor tests out there. So if you want to know how sure you are, you can also take one. Whatever method you decide on to quiz yourself, you have to be honest when you try to answer the question. No peeping. That is very important. No glancing at your notes. No flipping over the flashcards to see the answer. You have to be confident because, like I said, you need to know the content. So it's very important. You have to test yourself on the material. You can ask a friend to quiz you, or you can also take a predictor test. But whatever works for you, that is fine. How to prevent test anxiety. Test anxiety is another big deal. Helpful tips to handle exam anxiety. Anxiety is normal, but it's very important that you keep it in check. You don't want to have severe anxiety. Mild anxiety, moderate anxiety is normal when someone is preparing for exam, but you don't want severe anxiety. So it's always good to keep it in check. So how will you prevent test anxiety? You need to start on time to prepare. For example, if you are planning to take this exam in 3 weeks, in 1 month, you need to start on time. Not if you have exam in 1 month, you only have 1 week to prepare. That will cause you more anxiety. Take your time. That is what I usually tell people. Take your time. I understand things happen in life. Your commitment is not my commitment. If you have kids, it's different from somebody that don't have kids. If your kids are grown, it's different from somebody that kids are little. So you need to know your life activity. So start on time to prepare. That is very important. Evaluate how you study best, including the time. So if you are not somebody that study in the night, for example, I learned this from experience. Because of life activities, I always try to study in the night. But I noticed that anytime I study beyond 12 midnight, in the morning, I will have tension headache, and this headache will affect my whole activity for the next day. So what I planned is once it's 12 a.m., I don't care the exam that I have, I will close my book. So just find the time that works for you. Another thing, some people prefer to study where there is no noise. Then go to the library. But you need to evaluate your study habits. What works for you the best, Then give yourself enough time. Make a study part of your daily activity, like I have said it before. When you make it a daily activity, even if you're answering 20 questions in a day, it becomes part of you, but make it your daily routine. Prepare completely system to system. You have to cover all the systems. Don't assume that you know this particular system. Don't jump to another system. Make sure you know every system one by one. If you are talking about endocrine, respiratory, cardiovascular, all of them, know your system completely. Then identify your knowledge gaps, which is very important. Know the areas of your weakness. Know the areas that you need improvement. Avoid overconfidence. Oh, I know it. I don't need to read this more. No. Avoid listening to negative reports. This is very important. Oh, people will tell you, oh, that exam is so difficult. Oh, that exam, avoid listening to negative reports. This is one secret of success that have helped me. Why not listen to people that say that they passed? Why not listen to people that say they were successful? So don't focus your energy on negativity. I know that things do happen, but always try to listen to good reports. That will be helpful. You are in charge and not your anxiety. Repeat a positive word to yourself or even write it down on a piece of paper. Example, I got this. It will soon be over. This was really what helped me. You can write it down. I have to write my own on a sticky note. I pasted it round. When I looked at it, I said, oh, I got this. It will soon be over. Speak to yourself. Tell yourself positive words. Tell yourself that this exam will soon be over. Tell yourself you will still have your normal life. Exercise. It can also help you. Like when you become overwhelmed, you can take a walk. You can just leave your book, take a walk, drink water, eat good food. Help yourself. Don't use because you are studying 12 hours, 6 hours, 4 hours, you forget to eat your food. You forget to drink water. It's not helpful. And also, you can take a deep breath. I got this. You take a deep breath. That is also helpful. Some people, music help them. If you have a favorite music, you can play it. Some people like me, remember I talk from personal experience. Bible passage helps me, prayers helps me. It kind of helps to calm me down. So whatever works for you, some people is meditation, whatever works for you, but it helps to calm my exam anxiety down. Another final point is be kind to yourself. Prepare for the worst case scenario. I know that somebody will not like to hear this, but I'm a straightforward person, and I will tell you the truth. Sometimes in life, you tell yourself, it is what it is. I told myself, I pat myself at my back, I said, it is what it is. I have studied so much, I have done everything I'm supposed to do. At this point, even if I fail, I'm not going to be too strong on myself. I will try again. Failure does not define a man. Failure is not the end of a man. What makes a man a failure is when you fail to repeat again, or when you fail to try again. That you fail does not make you a failure. So to me, I find that it's very important that you are kind to yourself. Don't listen to what people are saying. I know that so many people, more of the anxiety is, oh, I told this person I'm going to take this exam. You can reduce that anxiety by not telling anybody. You don't owe anybody any explanation. Register for your exam, take your exam. I know so many people, it has also been part of their anxiety. Oh, what will people say? Oh, I failed it again. Oh, I feel so discouraged. No. Be kind to yourself. Prepare for the worst case scenario when you have done everything you're supposed to do, when you have studied so much, when you have worked hard, when you have done everything. The commitment was great, the sacrifice was great, the time was great. Then if it happens, just prepare for worst case scenario. Please be kind. I also want to introduce Prompt Review Total Prep products. And I like to say that exam stands between you and your goals, and Prompt MP Review is your tool to conquer it. Exams are stressful, but they are not impossible. Put the work in and you will see the result. Our study materials utilize carefully created review courses, and we ensure that you are fully prepared for all topics that the exam covers. You will love studying with prep products. So our prep products include 12 hours of comprehensive in-depth system review, including pharmacology, 8 hours exam secret crash course, 8 hours intensive predictor quizzes, and over 8 hours additional resources, pharmacology tip, common medication side effects, and sample study question. This is over 36 hours recording. Prompt NP review will help you to achieve your dream. With prompt review, you will spend less time studying and pass your exam faster. So far, our success rate is over 99.2% for first attempt and 100% for second attempt, guaranteed. So please, you can check out our review package on the website and more information on the Facebook. Personal experience, dealing with fear of failure. This is another point. Let your faith be bigger than your fears. So like I said, from my personal experience, I have to write out this Bible passage. I have to speak it to myself every time. It was really, really faith building for me. Psalm 34 verse 4. I sought the Lord and he answered me and delivered me from all my fears. So at that point, my fear was fear of failing this exam. It was so much on me. But when I came and read the scriptures, he built my faith up. He delivered me from all my fears. So exam failure can be your fear. But remember, depending what works for you, I am talking on personal experience. Another Bible passage that was helpful for me was Psalm 27 verse 1. The Lord is my light and my salvation. Whom shall I fear? So why will I fear that exam? The Lord is the strength of my life. Of whom should I be afraid? Another Bible passage, Philippians 4:13. I can do all things through Christ who strengthens me. I can do it because if you know what I went through, my experiences, it was really not easy. I know a lot of people that said, oh, I don't know if I can do this. But if you hear my story, it's really encouraging. Even with all these things, I don't know where to start from. I have a lot going on in my life, but I came out successful. So if I can come out successful, you too can. It was a lot of juggle, I didn't know how I did it looking back, and it was a great challenging time because at that point, the 9 months, it was so funny that I was pregnant and the exactly 9 months or the date of my delivery was the date of my graduation. It was exactly, it looks like a coincidence. But things happen, it wasn't easy. Pregnancy, trying to finish my MP school, jogging with clinical. But yes, I delivered my baby successfully. I graduated, so I have to write this exam. So even with a new baby and other babies or other kids, I have to do what? Write this exam. So it wasn't easy, but I pulled through. So I'm saying this in case I know some people that tell me, I am pregnant, do you think I can do this? I have little ones, do you think I can do this? And I tell them, I said, if I can do it, you can do it, because we can do all things through Christ who strengthens us. It's not easy, it's going to be difficult, but you can do it because his grace is sufficient and his strength is made perfect in your weakness. Also, I kind of somebody that likes to sing, so 2 songs that really helped me. There are so many other songs, but these 2 songs, Waymaker by Sinach and I Overcame by Ada Ehi, those 2 songs, I was constantly playing them when I'm driving, when I have nothing, to kind of calm down. I cannot play these two songs, and these two songs was a big help for me to go through, to pull through. Congratulations. Best wishes as you begin the next level of your career. Study smart and not hard. Study smart and not hard. You have made it so far to be where you are. And all I see is congratulations. Never you give up. Never you give up. Never you lose hope. Always have faith. It allows you to cope. Trying time will pass, as they always do. Just have patience. Your dream will come true. So put on a smile. You will live through your pain. Know it will pass and it will strengthen you again. Say no to exam anxiety. Exam anxiety. Thank you so